Hello, everybody, and welcome back to the show. This episode is brought to you by The Wellness Paradigm, a holistic health coaching company shifting the way that women understand and heal their bodies. Through bioenergetic testing, functional lab testing, and functional nutrition, we uncover what traditional approaches often overlook so you can stop guessing, start healing, and finally feel like yourself again. No more one size fits all protocols, just real answers, deep rooted healing, and the clarity and confidence you deserve to feel incredible. It's time to shift the paradigm of women's health. Now, on to our show. And good afternoon, Dr. Holly.
Hello, hello. Good morning from California.
Yes, and her name is actually Dr. Hollywood,
Yes.
which is amazing. Just saying that you're from California, but this is going to be a fantastic conversation for you guys. Something I think a lot more people need to talk about and have very open conversations about. And I'm so excited to hear your insight. But she is a licensed marriage and family therapist and also a certified sex therapist as well. And her work really focuses on helping individuals and couples heal from sexual trauma, strengthen their intimacy, and really build healthier relationships with themselves and with others. So, I think this is so important. So I'd love for you to give us a little bit more insight on who Dr. Holly is and how you really got into this specific line of work.
Yeah, yeah. So, oh gosh, who Dr. Holly is like a big question.
Yeah.
Um, like very existential almost. But yeah, so I am all those things that you listed. I'm also a mama, a partner, and a friend. And most of my work focuses on seeing clients via sex therapy. And I'm also a researcher, so I really use this scholar practitioner model to help clients with real evidence-based, accurate information to help them to tailor their sex lives to what feels most authentic to them.
Hmm.
As far as how I got into this work, let's see. So I actually started undergrad pre-med because I wanted to do surgery and then like in reconstructive surgery. And then halfway into it, I was on my sixth chemistry class and I was like, I'm so tired of this. Like, when does the doctor pull out the periodic table? Why are we still looking at this? And I took a gender and sexuality class as a breadth requirement. I was like, oh, I really like this stuff. This is really interesting to me.
Hmm.
And so that combined with some personal history with sexual violence, unfortunately. And then I started volunteering at the Rape Crisis Center locally in order to like do some of my own healing and give back to others.
Yeah.
And then I promise this is getting somewhere. And then the third piece of that is while in undergrad, so I'm taking these gender and sexuality classes, I'm volunteering during Rape Crisis, I have a regular job in retail, but I still need another job. So the only way to fit in another job was to moonlight at the adult toy store. So full circle,
Hmm.
I was doing the trauma advocacy work and then also doing what I call like the fun stuff or like my first taste of couples therapy when couples are coming in asking for product recommendations at the adult toy store. Kind of brought me to this place of like, oh, this is what I want to do. So then I went on to get my master's in marriage and family therapy, specifically to be a sex therapist, bringing those two worlds together, kind of focusing on the trauma healing and then the pleasure post trauma.
Hmm. And I think, first of all, that's so interesting. And I think you actually had your doctoral around sex toys, right? And around,
Yeah.
yeah, tell
Yes.
me more about that.
Yeah. So, I mean, full circle moment, I get into my PhD program and I have this idea about what I wanted to study when I started or what I wanted my research to focus on. And then I was like, I just want to go back to what's really lighting me up is what started me in the first place, which was trauma recovery and sex toys. So my research focused on the role of sex toys in women's sexual trauma recovery.
Hmm. I love this story. Um, now, trauma recovery and pleasure, there's this huge gap. A lot of people think they have to heal this one thing and it has to all be miserable and traumatic. And you kind of bridge this gap between this pleasure and recovery and talk a little bit about this process.
Yeah, yeah. So what was really, I think, a couple things. So one, I saw this gap, right? Which is why I used my research to try and fill that gap there, right? Like, when do we stop focusing on the trauma and the PTSD and get to move into a place of pleasure? And what I noticed in my practice is a lot of people were experiencing pleasure as being healing, right? Pleasure can be incredibly healing to somebody who's been through trauma. And I see that with clients, I've seen that in myself. And so, really focusing on that part. And I wanted to get to what of survivors who use sex toys, what did they find? Did they think it was helpful? Did they see it aligning with other therapeutic practices, right? I'm a therapist myself, so I'm thinking, like, does this make sense with what we know about therapy practices? And the results were wonderful. In fact, 100% of participants who, when asked, do they feel that sex toys were helpful to their overall trauma recovery, 100% of them said yes,
Mm.
and which was wonderful. And what I found was a few things, and a few things that really aligned with different therapeutic modalities, right? Folks said that it helped them to challenge negative beliefs about sex.
Mm.
So, for a lot of the participants, unfortunately, sexual assault or sexual violence was their first experience with any type of sex. And so it helped them challenge beliefs like sex is violent, sex is unsafe, sex is for the other person's pleasure and not for my own. So,
Mm.
kind of like um, using cognitive therapies, right? We might use like cognitive behavioral therapy where we're challenging these negative cognitions. It was the sex toy use was kind of aligning with that.
Mm.
The other thing that showed up was as a mindfulness practice. So, really helping survivors to rebuild that mind body connection by slowing down, focusing on their bodies, focusing on their pleasure. Also, it aligned with some feminist type of therapies in terms of empowerment. So, we
Mm.
know sexual violence is about power and experiencing a great loss of power. So, people saw the sex toy as like a literal putting something that is, especially if it's a vibrator, right? A device with power in it into their own hands. And then it made them feel empowered in that they felt more confident about their bodies, like they understood their experience of pleasure more, like they could ask for what they wanted in bed. So, developing that interpersonal assertiveness. And yeah, so all these
Mm.
different things showed up in their experiences that really aligned with other therapeutic practices that we see and also allowed them to experience pleasure.
Mm. You know, I feel like there's so much shame around this kind of talking about this, and I'd be curious if a lot of the women that come in kind of have this shame around what, like, feeling this way. They know they shouldn't feel this way. They should feel a different way. They maybe don't. Maybe they grew up in backgrounds where this wasn't talked about or expressed. Like, how do you help clients move through those like very deep-rooted beliefs around, even if there wasn't necessarily trauma, but around this shame?
Mhm. So, around like shame and sex and shame and sexual pleasure
Yeah.
specifically. Yeah.
Hmm.
So yeah, that happens for a lot of folks. And whether it's from your religious background or your cultural background or just what you heard in the home or what you didn't hear, a lot of times folks say, well, sex wasn't talked about at all. So it was like in the not saying, it became clear that this was something that we don't talk about. And in particular for women, right? So women tend to be socialized to take care of others, to please others, to make themselves small so that others can take up more space. And so that certainly bleeds into their sex lives, right? They start having sex for the other person's pleasure and might develop these scripts that, like, sex is for, and we're talking like cis straight folks, right? We're talking like sex is for the man's pleasure, or like we learn the script that the first time is going to hurt, so then they anticipate that sex is going to be painful, or good girls don't have sex, are some of these scripts that get ingrained in us. And so in my work, what I like to do is really sit with those scripts. Where did they come from? Identifying where those came from, and then sitting with, does that feel authentic to you, right? Like, do you really think that good girls can't have sex or good girls can't enjoy sex. Where did this come from? Is there any evidence that we can pull up that shows that that's maybe not, might not be true? Right. And really getting them to sit with what feels authentic to their own values and beliefs.
Mm, yeah, that's an interesting one because I feel like especially having your knowledge on really therapy and going deeper on this, it's like changing belief systems is a whole nother ball game, you know? And
Hmm.
I'm sure you see a huge breakthrough. Actually, I'll kind of let you take the floor on this. Like, what are some of the biggest breakthroughs that you see with clients when they really embody this type of work and, work with you?
Yeah, I mean, the just seeing people change like and come to these newfound beliefs in a way that feels authentic. I'm trying to think of like specifically like breakthroughs, right? But there's, times in which I have clients say like, "Oh my gosh, like I had sex for the first time without pain because we were able to challenge what was happening in their bodies that maybe caused a physical reaction because of that psychosomatic connection. And they were able to then, release this shame around feeling like, I can't have sex before marriage, or a good girl can't have sex. And now they can actually relax and enjoy pleasure. Or when folks, clients might reach out and say, like, I finally had my first orgasm and it was great and I don't feel bad about it. Or being able to like engage in dating and set boundaries, right? It's not always about all these things that they get to say yes to, but also really seeing breakthroughs in people feeling comfortable saying no to different things and different people in their lives.
Mm, yeah, gosh, that's a big one. I know I work with a lot of those clients and it's so interesting too, the somatic work behind all of this too, because so often, even with clients that we work with, low libido, pain, it's like I can't really out supplement this, It's like
Mhm.
there's some deeper reasons behind this that you're, gonna have to work through. That's not always comfortable per se, but that's gonna be what's gonna break you through.
Mhm.
And that's where I know I have seen clients see the biggest benefit is when they really hone into this kind of level of work, on top of obviously taking care of their body on a physical and mental level, right?
Mhm.
Um, is there a certain mindset shift or practice that if somebody was feeling maybe really disconnected with their body, with their pleasure, with their intimacy, what's like a little baby step if someone was kind of trying to tiptoe into this kind of work?
Yeah, I mean, even just gathering information, I think like the smallest like baby steps, and I like to work in that way, like kind of like a ladder approach, like starting with what is feels most comfortable, but it will also stretch us a little bit. I think accessing information is really that first step. Unfortunately, sex education in this country is absolutely terrible in most places. So just opening yourself up to reading different books. There's a lot of great books out there. I often recommend the book Come As You Are by Emily Nagoski. That one's great. um, Listening to podcasts, right? Things like this that allow you to gather information that is accurate, evidence-based by people who are actually, licensed in these fields or have done the studying and can share that information with you. I think that is the first baby step.
Mm. Yeah, I feel like there's not a ton of licensing around, this kind of area. And I know there's a lot of people that talk about it, but when you're diving really deep into again this huge, not physical, but also mental part, like having somebody that has, some degrees and, knowledge and education around it can be really helpful to make sure you're steering them in the right direction. Have you
Mhm.
seen people that have come to you having worked with other people before on this topic and it's maybe put them down a little bit deeper of a hole? Maybe it hasn't helped.
Yeah, yeah. Unfortunately, I'm usually not people's first therapist.
Yeah.
And I think there's also a reason why sex therapy is a post-master certification. I always say, like, in order to be a sex therapist, you have to be a good therapist
Yeah.
first, right? Because there's so many times that people might be presenting with issues around sex and intimacy, and it's like, oh gosh, well, you also have generalized anxiety, and that's coming into the bedroom. Like, let's work with the anxiety. Or you're having relationship issues. Like, let's also take a look at what's happening in your relationship, right? Maybe you're experiencing pelvic pain or tightness, not from a physiological standpoint, but your relationship doesn't feel safe. So your body's actually doing what it's supposed to by tightening up and protecting you, right? So can we look at that? So yeah, unfortunately, I'm usually not people's first therapist, and sometimes they meet with someone who, even as therapists, we have our own edges. We're humans, we have our own judgment, and they might meet with somebody who's a great therapist in all other things, but maybe just isn't well equipped in handling that sexual piece that they're bringing into therapy. Or maybe the therapists themselves aren't comfortable with that. And so when the
Yeah.
client brings it up, might get feel more shame.
Yeah, for sure. Um, do you primarily work with the female or are you working with couples as well?
So I work with all genders. I work with men, I work with women, I work with gender nonconforming folks,
Mhm.
and I work with couples and sometimes more than two.
Yeah. Now, in this, you know, we'll just talk about intimacy primarily, in the bedroom, but what are you primarily hearing from people when it comes to their dynamic in the bedroom and maybe what they want to work on?
Yeah, the number one thing that comes into my office, and in fact, I just had a call about this morning, um, for a potential new client, is what we call desire discrepancy or a mix match in libido, right? Somebody wants more sex, somebody wants less sex. Maybe the person who wants more sex feels love and connection through sex, and the person who wants less sex needs love and connection to want to engage in sex.
Yes.
That is the most common thing.
Yeah, I hear that too with a lot of clients. That's an interesting. Now, we don't have to go into the depths of this, but I am curious. I've heard this on so many different levels and I'm always curious on what people's feedback is on that. Like, where would be maybe one place you would start or be curious a little bit more to ask about to explore that dynamic?
um, Let me see if I get the question. Like, where would I direct a client as they're kind of exploring, or like how would I support a couple through
Yeah.
this?
Yeah.
Yeah. So again, it always starts, so much of sex therapy is sex education. And so I think it starts with some sex education on how desire works. I think most people have this idea that we get from movies or from adult films around how desire works, right? That you're just supposed to have this like instant feeling of horniness, that it's spontaneous, when in fact people experience desire different ways. And so I think what's most important is to first take a look at, how do you experience desire? How do you experience arousal? Are you somebody who needs stimulus? Are you somebody who maybe doesn't feel excited to have sex, but once you start doing it, you're like, oh yeah, this feels really good. And now I'm into it. It's just that first step that's hard. Then you might be somebody who identifies with having responsive desire, right? So there's two main types of desire. We have spontaneous desire, and that's like what we see in movies, where it just pops out of nowhere. And then we have responsive desire, where people feel arousal or feel that wanting to engage feeling after a stimulus. And that could be a physical stimulus, or it could be something like watching a sexy movie or listening to erotica or seeing your partner do something that makes you feel really good or makes you feel really connected. So that's always the first step. I like to look at, how do you experience desire? And then once you know how you experience desire, you can kind of take a look at things and see what prompts your feeling of desire. Is it those things like I mentioned, listening to erotica, reading a steamy novel or something like that? And can you use that to kind of kickstart, right? I like to say like preheat your oven, right? Some people, the spontaneous folks, they heat up like microwaves, and the responsive folks heat up like ovens. And sometimes we need a little preheating, and that's okay.
That's an amazing analogy. I have to use that for clients. Um, you know, with heating up or with maybe exploration and play, for somebody that's maybe not used to like a sex toy, doesn't really know what they are, maybe they've heard of like a vibrator or a
Mhm.
dildo. Like, how do you gently introduce them? And out of curiosity, what are the favorites that you've had with clients that people have said, like, oh, this has really changed the game or has been really great or, given a lot of positive feedback on?
Yeah. So I always recommend looking into a local adult toy store. I know it can be kind of scary to go into a place like this, and they're not all created equal. So, like, take a look. Like, you'll see some that are maybe more like feminist leaning, and maybe some that might be a little more sketchy. So, take a look, but there's lots of really great ones around you. I would avoid jumping straight to Amazon. It's just like other things, like you could put you at risk for getting counterfeit or things that aren't like of the best quality. But if you can go into a store, and the great thing about these places, and I remember I worked at one at some point, is that they get so much training and information and really like know everything, right? It's like when you go to a restaurant, you ask the waiter, like, what's your favorite thing on the menu, right? They're going to know about the food that's at this restaurant. The same thing with looking at the adult toy store. So I would definitely recommend going there. These people are trained. A lot of them make you feel like it's really safe, and it's a great way to kind of explore what's out there and see what's going to feel best for your body. As far as my favorites, I'm a classic magic wand kind of a gal. It is like your grandma's back massager. Um, However, it can be really strong. So if you want something that's not as strong, another brand that I've been really liking lately is the Plus One is the line of toys, and they actually even sell them at Target. And they're really good quality silicone toys, lots of different styles, and super affordable because sex toys can be really expensive too. So if you're like just trying something and you want to try like a style, like a rabbit versus a wand, I'm like, try one of these. They're like $35. And that way, maybe if you want to upgrade to the $200 one later, you go and do that. So I love those. And then I know a lot of people are fans of the suction style vibrators. So they're have like air pulsing clitoral suction technology. And so the womanizer is a great one for that, although I don't love that name. They make some really good suction style vibrators.
Oh, that's awesome. Yeah, I feel as if it could probably be overwhelming where people are like, "Oh, this sounds great," but then it's like anything, there's like so many different things and it's people just don't know where to start.
Mhm, mhm.
So, appreciate those tips. Now, if somebody
Sure.
wanted to really dive into this work a little bit more, get some additional help and guidance, where can they connect with you personally and where can they learn more about like what you do and what you offer?
Yeah. Absolutely. So, if you want to connect with me, the best way is via my website, and that is thehollywoodsexologist.com. And if you want to, do more of a deeper dive in any of these particular topics, maybe we've touched on, or some other topics in the realm of sex, relationships, and mental health, you can access that all free information on my YouTube channel, and that is the same name at The Hollywood Sexologist.
Awesome. Awesome. And if people wanted to shoot you a DM or connect with you on social media, do you have an Instagram? Right?
I do. Instagram is a different name because Instagram has different censoring, but that one is Dr. Hollywood, PhD.
Yes, yes. I've had other guests too where it's like it gets a little bit tricky on Instagram. So
Yeah.
and why go check out her YouTube, guys.
Yeah.
Um,
Better information there.
for sure, for sure. Well, thank you so much for being here and sharing, all your insight and wisdom. And if you listeners want to reach out to her, shoot her a DM or a message, definitely go check out, or, even all of her free stuff on her YouTube would be amazing. And so thank you for your time here, listeners. Of course, thank you for being here as well. And we'll catch you guys on the next show. Thank you.